To health matters now, as the strike embarked upon by the National Association of Resident Doctors continues, patients have deserted the Federal Medical Center, Asaba, the Delta State capital, for fear of not getting medical attention. Management of the facility is struggling to attend to few inpatients while not admitting new patients. The striking doctors insist that until all their demands are met, they will not go back to work. Ikina Amechi reports on this.
It is 13 days into the industrial action embarked upon by the National Association of Resident Doctors. The wards in this hospital are almost empty as striking doctors who form a major part of the healthcare delivery continue to stay away, insisting on the federal government meeting up with the agreements reached by the Memorandum of Action. They accuse the government of paying lip service to them.
Till now, what we're still getting are promises. For instance, the people that are on GIFMIS that are supposed to be moved over to IPs, the whole situation has been verified, and that was one of the reasons the Memorandum of Action was signed. Now, that has been signed, and you are still saying you are going to verify for another 1 or 2 weeks. Are we still going to wait for that when you have not proven so far that we can trust you to implement what you have signed?
We suspended our last action based on the Memorandum of Action placed before us by the federal government, collectively signed by both our national union and federal government, to try to resolve the issue. 135 days after, we are in the same spot. Nothing has been done about all our 11 demands. We are still in square zero.
As the federal government and striking doctors are yet to reach a new agreement, patients bear the brunt as they appeal to both parties. Chief Medical Director of the hospital says it has not been easy since the doctors down tools, but say they have adopted ways to cope, while appealing to the doctors to resume as government has shown commitment.
We are not admitting cold cases for now because they take the calls. After 4 o'clock, they take the calls to see the patients in the night, and they're not there. So any patient that will require that intensive care, we don't keep, because if he has crisis in the night and we're not able to provide that service, we could be sued for it. So we're not keeping those category of people. And also because the news has gone out that doctors are on strike, so the patients are not even on their own. There's even a lot of them stopped coming. So activities are at about 30-40% right now. So, but for those that are coming, what we have done is that we make sure the emergency points are running, are covered.
As the country continues to witness a spike in the third wave of the COVID-19 pandemic, it is expected that an amicable resolution will be reached soon so that the striking doctors can return to work to help in flattening the curve. Ikena Amechi, TVC News, Asaba.